Hi, I'm Dr. Jack Ziegler. I'm one of the spine surgeons at the Texas Back Institute in Plano, Texas. For the average guy, I think golf is a safe sport, and I tell this to my patients all the time. It's one of the only sports where you're pretty much in control. Unless you're taking a really hard swing and you happen to hit a tree root, most of the time you can control the pace and the level of your activity. You're not going to get blindsided by a linebacker coming at you as you're setting up for your drive. So it's a sport I do let people go back to much quicker than I'd let them go back to a contact sport. But having said that, at the elite level, golf is tremendously demanding because Tiger Woods' swing is basically coming from his lumbar spine, from his core. And the rotation that he can put on his lumbar spine is what powers his 300-plus yard drive. So he is putting a lot more stress on his lower back than the average golfer, but he's much better conditioned than the average golfer. I've sort of followed him as an admiring fan, just someone who's a top grade athlete who's unfortunately had some physical problems. He had knee problems, knee surgery, and more recently when he had his back injury. And my understanding is that he had disc disease and had a microdiscectomy. And he's recovered from that, tried to go back and play golf, had some episode of back spasm and pain, but apparently now is doing better and is going to try to play again. There's several reasons why someone who's recovering from a laminectomy can have a flare-up of back pain. And it doesn't matter if they're a professional golfer or a truck driver or a school teacher, it does very commonly occur. And most of the time, it's not anything serious. Most of the time, it's a muscle pull or a local strain or sometimes tearing some scar tissue. And so we try to tell people when it first happens not to panic, to just back off a little bit, use anti-inflammatory medicine. And most of the time, it'll resolve. The times it doesn't resolve, we do have to investigate it further. And the worst thing we worry about is a recurrent disc herniation. But statistically, the main reason is an overuse strain or just part of the normal getting back into activity. When you talk about an elite athlete like Tiger Woods, he is putting much more stress on his lower back than the average person. But the flip side is he's in superb condition. All of his tissues, his muscles, his ligaments are better than anyone else's, and his mechanics are better than anyone else's. So it's sort of a balance between the two. But the fact that he has recovered relatively quickly and is confident now that he can come back and play this weekend would lead me to believe that this is just one of those bumps in the road that happens as you're recovering, and hopefully it doesn't mean anything bad is going to happen.